let's call the meeting to order at 6:34-ish. Can I get a roll call? Or do I need a roll call? Okay, we know who's here. First item, consideration of the meeting minutes from April 21st, 2025. I hope everybody had a chance to look them over after they were sent to us. Are there any amendments, changes, or concerns? If not, I would entertain a motion to approve.
So moved.
Second.
Seconded.
All right, all in favor of approving the minutes as presented?
Aye.
Any opposed? All right. Public comments of items not on the agenda. Is there anybody from the public who's here to comment on items not on the agenda? And the agenda is pretty much the shelter house presentation. So if you're not here, or if you're here and you want to talk about non-shelter house presentation stuff, can we make a, I was going to say, I know Stan was here tonight to say hi. Do we want to do that as staff and commission updates? Or do we want to just let him get home if we had anything to talk to him about, or?
I think he's here for the shelter house presentation
Okay.
if any related questions come up.
Okay, perfect.
Unless you have any public comments, Dan.
All right, well, in that case, we'll move on to Agenda 4. Shelter House presentation. Staff is here from the Shelter House to give an overview of services provided for people experiencing homelessness as well as street outreach. For those that weren't here last month, one of the discussion items that we talked about kind of at the end was, I think I brought up asking about what was being done for, I don't know, was basically the homeless on the street. We've seen obviously a real increase citywide in the last couple years of transient populations not transing. You know, we used to really see a lot of them during the summer, but then they'd move away, jump the rails. We didn't see as many during the winter, and it seems like more and more are staying. I had some questions about and I know I reached out to Stan, also talked about, for if they're out on city property or they're on private property, like what do they have access to as far as like facilities or trash or bathrooms? And I know Shelter House has in that front area quite a few people I know that are staying there part-time, full-time. So yeah, we just kind of were trying to get an idea of that problem. I know Shelter House has kind of been the predominant provider of services to that population in town. So yeah, we just kind of were hoping that you could give us some insight as to what we're seeing in Iowa City, what that population has access to, what more does that population need, how do we get people transitioning, from living in a tent or laying on a mattress out front to more permanent housing. So yeah, welcome. Okay.
Hey, everybody. I'm Sam Brooks. I'm the Emergency Services Program Manager for Shelter House. So that encapsulates our main emergency shelter, the street outreach program, and our winter shelter. And prior to that, to this role, I was the street outreach and engagement specialist, so working specifically with those unsheltered folks.
And I'm Erin Sullivan. I am the Director of Programs for Shelter House. So under my umbrella are Sam and all of the programs he mentioned, as well as our housing services. So that's when you kind of get into that realm of rapid rehousing, which is a short-term housing intervention, and then permanent supportive housing, where you get into that more long-term housing intervention. And so we are going to kind of talk to you a little bit today about street outreach. Sam's going to kind of go over the model of street outreach that we use in the community here, some of our data points, and then I'm going to talk about kind of the chronic homeless status and some more information there. So.
Yeah, so street outreach for us, we are really focused on the same model we use for all of our housing services, which is housing first, right? So our approach to street outreach is about meeting folks where they're at. So going to natural congregations, going and meeting folks at free meal sites, free lunch, agape breakfast, the library, places where people are going to be anyway, and engaging with them in a more trauma-informed way where it's all voluntary. You can't be court-ordered to be in street outreach program or committed through a hospital. So so by going into these places where folks already are, we're offering a wide range of services to get folks connected to our other programs, our rapid rehousing program, permanent supportive housing, coordinated entry, and really helping folks navigate all of the complicated systems that somebody who is currently experiencing unsheltered homelessness might need to work through to move beyond that experience of homelessness. There's a lot of ways that we go about engaging with folks. We receive referrals from a whole host of different partners. City staff is a big source of referrals and a big partner for us. ICPD, folks at the library, pretty much every city department we engage with, and they send referrals to us, where they're seeing folks who are unsheltered. We also have a lot of community members who send us referrals, and we also have many folks who are in the homeless population currently experiencing homelessness who are also sources of referral. As we build trust and work to kind of engage with folks who are staying outside and show that we're a safe resource, then other folks are going to help us kind of connect with some of those folks who have high barriers and are maybe a little harder to engage with. So in 2024, we engaged with 291 unduplicated individuals. 90 of those folks in 2024 transitioned from the street outreach program into permanent housing. So they are now in stable housing. And of that 291, 167 transitioned into some positive housing destination, whether it was a self-resolution to staying with friends or families, or long-term care facilities, different destinations like that. So there are a lot, one thing that we, on top of connecting folks to housing resources, a big role of street outreach is to provide those life-saving supplies for folks who are staying outside, especially in the winter, providing tents and sleeping bags, propane, space heaters, gloves, hats. In the summer, we're helping with water and keeping folks hydrated, really making sure that, this crisis, this ongoing life-threatening crisis, we're trying to mitigate as much of the risk as possible along with the folks who are staying outside. I don't know, Aaron, am I missing anything on street outreach? We could talk about the point in time, too.
Yeah, point in time, and maybe just like some of the kind of conditions you see.
Yeah.
Can I just ask a question real
Sure.
quick? The numbers we're seeing are people who have been engaged with street outreach, but that doesn't encompass the entire homeless population, is that right?
Correct.
Okay.
Yep. So, folks folks who are in the shelter wouldn't be considered in that number.
Or homeless that you haven't just been able to connect with.
Yes, there
as
might be
well.
a little bit of duplication. So sometimes individuals who are enrolled in street outreach, they might come into shelter for like a night. There are definitely individuals who probably will stay in winter shelter. Not all of them, but some of them. So this is an unduplicated number for individuals who are enrolled in our street outreach program in our homeless management system, but that if we were to pull an unduplicated number for all of the individuals we serve through like our emergency shelter, winter shelter, and street outreach, then that would be a different number. That would be much larger than the number that you're seeing.
I guess what I'm asking, and maybe we don't know, is are there homeless people who aren't accounted for in any of your numbers? Do you know if there are people who just don't want to be?
Yeah, there would be,
Oh.
there's a handful of people who, so like Aaron said, this 291 is folks who we've enrolled into our data homeless management system. There are folks who are not at that point of engagement that we work with through street outreach in, it could be as simple as just like casual small talk on a regular basis, or we bring them some supplies here and there, but they're not at a point where like we're enrolling them into that system.
I think you spoke with us a couple years ago, maybe?
Last year, yeah.
Last year?
Right?
And I remember just thinking what a wonderful job you were doing with the unhoused during the bitter, cold winter months and providing what they needed just to stay warm or to eat. And I was really impressed with that.
Well, thank you. So that actually is the point in time, which is the third week in January. So that is a nationally required single night census count that anyone who, that homeless response systems across the country are required to participate in. We lead the count for Johnson and Washington County through Shelter House. In 2025, so January 21st or 2nd, whatever that third Wednesday was, the number of people staying outside was 38. That is higher than 2024, which I believe was 24 off the top of my head. We also, when we added there's a survey that is completed that is required. When we did the count this year, we added 2 questions, which you can see down here at the bottom. We asked folks if there was a bed available at the shelter tonight, would you use it? Nobody said yes. Some people rightly pointed out that, well, there is a bed if I go to shelter, right? And we said, yeah, but, so then we asked if there was an apartment available to you tonight, would you move in? And 35 of 38 were interested in housing. You know, that's something that one thing through my time working with street outreach that I've come to I think recognize, and I don't want to speak in generalities, but I've not really come across a person who, given the correct, affordable and accessible unit for them, would not be interested in housing. Yeah, so I guess I'll stop there and turn it over to Aaron.
Yeah, so I'm just going to talk a little bit about chronic homelessness. So the group of individuals that Sam identified, where we're engaging with them from a street outreach standpoint, some of those individuals are experiencing homelessness maybe for the first time, maybe it's been multiple times, and are just maybe not able to get a bed and shelter because we're full, or they are not interested in sleeping in shelter for various reasons. And we're, engaging with them and providing those services, both as Sam said, to help them stay safe while they're outside, but also those case management services to help them navigate kind of the system to move into housing. And then, as I think you kind of asked, and as Sam identified, there are some individuals who are not really that far engaged into the system, into kind of our healthcare system, into our housing systems. And so those are the ones that oftentimes meet that chronic homeless status. And I am not going to read the definition to you. I didn't even put it on here because it's just like HUD jargon. But essentially what it is that you have experienced homelessness for 12 months or longer, and you also have a disability. And that disability, you could have a mental illness, substance use disorder, or it could be a physical disability. This population of people make up a much smaller percentage of the overall homeless population, but their needs are oftentimes more acute, and their experiences are definitely more entrenched. And so these are individuals who oftentimes, as I mentioned, well, they do have a disability and they're survivors of trauma. And we see them cycle through many of our systems, but they don't have to necessarily do that. Sometimes there are individuals who just are outside in our community for long periods of time. So I'm not here to talk to you in depth about permanent supported housing, but it's definitely an intervention for individuals who are chronically homeless. I fully believe that anyone who has lived outside for more than 12 months needs to move into a supportive housing environment. Moving into just kind of straight independent housing without those supports can be really difficult for the person to transition and maintain that environment, not just because of financial strains, but also the kind of challenges that individuals experience as they are living in a community with neighbors and kind of have to kind of interact in this world that maybe they struggle within for many different reasons. And so, you know, I think I heard kind of some comments and thoughts about our winter shelter services, and Sam mentioned those as kind of one of those services under his umbrella. And we see a lot of the individuals who are meeting HUD's definition of chronically homeless using that winter shelter service. Being able to come in during the coldest months of the year. We open that winter shelter between December and March. So really it's like 15 weeks during the coldest months that we're making sure we're providing just a safe, warm place for them to go. However, actually I should add, at the same time, our shelter at 429 Southgate is a 70-bed facility, and we get a special permit with the city to be able to expand our census by 30 more individuals. So in that building, we can serve up to 100 individuals. So between 429 Southgate, which is the emergency shelter serving 100 people, and our winter shelter serving anywhere between 40 to, I would say, 50 individuals is like our kind of on the high end.
And where is the winter shelter?
That-
That's not at Southgate?
That is at 340 Southgate Avenue.
Across-
So
okay,
it's connected to the GuideLink building,
Got it.
but not associated with GuideLink. That project is only open from 5 p.m. to 8 a.m. And so really it's a place for them to go during those overnight hours. As Sam mentioned, there's lots of engagement with individuals to make sure they're aware of that service, including emergency services as they're running into individuals, helping them, notifying them that that service is open and or taking them there if they need someplace to go.
And what are the winter months for that? That's from,
That is, so winter shelter is December through March. It's like
Okay.
usually the first Monday in December through the third week in March. And then those overflow services at 429, we extend, that is more from November, beginning of November through, this year we went through end of April. So April 30th was our last day of overflow.
Where's 429?
That is our emergency shelter. Sorry, I use addresses when I speak about the buildings because I think it's really important for us to
On
know.
the same street as
It
everything
is.
else?
Yeah,
Okay.
they're like kitty corner from each other, the winter
Okay.
shelter and the emergency shelter.
Okay,
Is
thank
the
you.
winter shelter that you have now, is that a permanent site for that?
It is,
Because
yes.
it used to move around.
It did,
Yeah.
and finding a location every year was really difficult.
and what is that space used for the rest of the year?
I believe the county has it open and available for people to use and rent. I don't know what it's used
okay.
for.
Okay.
So, but we use that space typically between December and March. And so this year, I want to just kind of mention, right, the individuals that you kind of identified that are sleeping either on shelter house property or as we see kind of increase of individuals who are sleeping outside. I really like to point out that the individuals who are sleeping on shelter houses property, I mean, they're about as close to the services as they possibly could get. Any of the individuals who are sleeping on shelter house property in that area, we have what we call rights and responsibilities. And really it's kind of the rules of shelter. And everyone who is sleeping on the property does sign a rights and responsibility. So there are certain kind of expectations that we have as people are sleeping on that property to be able to kind of keep it safe and keep all of us, all of the individuals on that property safe. And so that is, so we are very much aware of who is sleeping there, engaging with them, street outreaches out on a regular basis, engaging with the individuals as well as our daytime staff, our front desk staff, engaging and just helping to address any like immediate needs while also trying to work with them to help them identify a kind of housing solution for them.
Are they able to stay there 24 hours, or do they have to leave during certain hours?
Yeah, so we do not manage the people outside in a way of saying that they need to leave the property at a certain time. We see many of them go out in the community during the day to get some basic needs met, but if they wanted or needed to stay there on that, in that area, they can.
Question.
Really well sought out property for people.
Do you monitor the tents so that you are sure it's the same build, same tent, even though the people do not stay there all the time, but the structure is the same person? And how long do they stay there? How long do you allow them to be there? 1 month, 2 months?
Yeah. So I think your first question was about the tents. Like, is it who owns the tent?
No.
Oh.
Is a question on how long can a tent stay there in the property?
Okay, so that's a good question, and I'm going to be honest, we're navigating this space in terms of letting, having individuals sleep on our property as kind of a new experience for us. And so we have not set a length of time for somebody who can sleep on our property in a tent. Our goal is to engage with them, help them locate housing, and move them into permanent housing. Honestly, the question you're asking is how long it takes for somebody to be from homelessness to housed really depends on the barriers of that person, and also the affordable housing units that we can locate in the community. So where the federal government might put a timeline on it to say that they would like people to be rehoused in 30 days or less, in our community, that is very difficult to do. The lack of affordable housing, the lack of housing that doesn't have high barriers to being approved is a challenge for individuals who oftentimes have extensive kind of barriers. So barriers meaning credit scores or the lack of income to be able to show that you make 3 times the rental amount that is due. Or having sometimes a criminal background, and or just other kind of criteria that some landlords put into place.
Is it common in Iowa City for there to be the requirement that you need to make 2 or 3 times your the rent? Is that something that's fairly new?
I would say it's something over the last 3 years that has been taken, like there were landlords who had that requirement, but it's kind of, you're seeing pretty much almost all of the landlords have that requirement at this point. So it's definitely a challenge, and oftentimes landlords will not count a housing choice voucher as income. And so if you have a housing choice voucher that is able to cover, 30% of your rent, they still expect you to have 3 times the rental amount to be able to be potentially approved.
Thanks for explaining that. That's a real eye-opener to me. As a renter, I've never run across that, but I've been fortunate to find private landlords or to be in specific programs for properties that have requirements to serve,
Yeah.
a certain population. So that's an eye-opener.
Yeah, there's also been some experiences or some criteria lately that I've seen where they've expanded or extended the amount of time that somebody needs to have kind of references from or a positive reference. So where we were seeing landlords previously ask for maybe 3 years of a landlord reference, we've seen denials now where it's because they don't have 5 years of
Wow.
a landlord reference, yeah.
I want to come back to the question of the tents.
Yeah.
Can you tell us a little bit about the demographics of the people who have the tents? Some children, mix of different people, and if at all you do, these are like 3 questions. You do take in statistics, some data to help the city know. The city likes data. We are getting more into data right now. They wanna see the counts, not they see them. Even if it is one person, it really matters. But for funding issues, I think the data really is important.
Yeah.
And so.
Yeah, so we do have demographic information for the individuals that are in our homeless management system. So anyone who's staying at shelter, anyone who is enrolled in street outreach, and then also any of our other programs. So demographics and data is definitely something that we collect. I'm going to answer your question about the individuals who are specifically outside, and then I'm actually going to let Chrissy maybe talk about the from a data perspective. But so I think I'm going to speak more broadly, not just about the individuals who are sleeping on shelter house property, but people who are sleeping outside across our community. It is a wide range of individuals, male, female, individuals who identify as trans, from an age range, anywhere from, we serve individuals within our programs who are 18 and older. However, there are individuals who live outside who are under 18, and we do engage with and provide services and try to get them connected with other local resources that provide services to people who are under the age of 18. This last summer, we saw probably more than what I'm used to seeing, youth who are living in a car and who were experiencing homelessness, all the way through to, yeah.
Do you know a reason for that?
I could speculate on a lot of things, but I can't say necessarily for one specific reason. Oftentimes family dynamics and or other kind of just household or like, family-related issues. I also will say that there are individuals and families who are experiencing homelessness. They might be doubled up and sleeping in a friend or family member's house that they're now not able to stay in for one or another reason. So, and then going all the way up through to individuals who are aging. We're seeing quite an aging population. We have an individual who is physically disabled and in a wheelchair. Who we have individuals who are part of a family unit. So a single mom with some children. Homelessness doesn't discriminate, and when you don't have access to shelter but more importantly, affordable housing, your options are limited. And I also want to just mention that it's from like a safety perspective, the individuals where we see them kind of sleeping in more visible areas is because it is more safe to sleep in those areas than it is in isolated areas that are not kind of connected to the community. And I can answer more questions about the demographics, but Shelter House we are in the process of a kind of data project, and I'm going to let Chrissy talk about it just because she
Yeah, I wanted to know.
it flows
Okay.
better from her.
Okay.
Thanks, Erin. Hi, I'm Chrissy Canganelli. I'm Executive Director of Shelter House. I do want to just amend, this is falling, because it doesn't want to stay. There. Erin's comments about, just to add on to data, we are very regulated when it comes to data and have a great deal of compliance requirements because of the HUD funding that we receive, the VA funding that we receive. So I just want to provide assurance that we do a lot of data management collection, and it is well managed through a HUD-mandated homeless management information system. So more than most nonprofits. On the subject of just data overall and understanding the impact of homelessness, the occurrence of homelessness in our community, we sought funding and have been able to secure funding and invested some of our reserves into two initiatives that will be ongoing throughout the rest of this year. There'll be parallel initiatives. One, we're partnering with an entity called the Corporation for Supportive Housing, and that's a national nonprofit. They work primarily to develop capacity of permanent supportive housing throughout communities across the country, but also have a good deal of experience in developing needs assessments for homeless response systems to establish, and this is going to be a little jargony, but to establish a flow of resources in a community such that in any given 30 days, the number of people that a community places into housing exceeds the number of people who are entering the homeless response system. So Corporation for Supportive Housing is data mining our data in our homeless management information system, working with the Institute for Community Alliances that oversees homelessness data for the state of Iowa and multiple states across the country, to gather insight into shelter house data and data for our region. And then they're also working across systems with partners like University of Iowa Hospitals and Clinics, the jail, police department, there'll be other city departments involved. Ambulance, different partners that engage with individuals experiencing homelessness to try to get as panoramic a picture of the impact of homelessness and the occurrence of homelessness in our community, and really ensure that they have an understanding of the nature of the individuals experiencing homelessness in our community to help us build out and assess what is the capacity of the different interventions that we need to fine-tune this homeless response system to achieve that balance that I mentioned, which is called functional zero. But is that point where you're placing more people into housing in any 30-day period than are coming into the homeless response system. I'll say that it kind of dovetails with some of the information that we also wanted to share with you this evening, which on the back of the paper shows the rate of chronic homelessness in the 5 most populous counties in the state of Iowa, and then for the state of Iowa. And you can see Johnson County has the second highest occurrence of chronic homelessness in the state of Iowa, second only to Polk County. So there are, some pull factors that are creating that, and it's not Shelter House. The primary pull factors are the University of Iowa Hospitals and Clinics and the VA Medical Health Care Center. We have a very complex population that we're working with, and that does impact our ability to create flow and move people, not just from the street, but from our shelter into housing. again, echoing comments that Aaron shared as far as the barriers that people see, that people face to be able to secure housing in our community. In spite of the resources that we have, the case management, the funding, there are other barriers that we're having to address for this very vulnerable population. The second parallel data-driven project that we are exploring is working with an entity named Brilliant. It's not brilliant, spelled wrong, it's Brilliant, I don't know why. But they're a group of folks that live in the healthcare world and the intersection of healthcare and technology and data sharing. And we've contracted with them to help us explore our community's capacity and interest in developing data sharing and data matching technologies and building an infrastructure to be able to better serve individuals through data sharing and data mapping to be able to improve the health, housing, and service outcomes for the individuals that are experiencing homelessness and at risk of homelessness. So our desire is to really just pull back the curtain and create transparency and visibility through all intersecting partners across the different systems. And in that initiative, we have the pretty much the same partners, University of Iowa Hospitals and Clinics, VA Medical Healthcare Center, Johnson County Sheriff, different city departments, Housing Authority, Community School District, Corrections, Department of Corrections, same types of players that are in these initial stages of completing surveys, going through interviews, and ascertaining what our capacity and our appetite and capability is to develop this data sharing system. So we're really excited about this possibility.
Excuse me before.
Yeah.
So at the point of intake, how difficult is it to collect information from the individuals to help you determine some of those barriers you're talking about?
Well, that's not going to happen at intake. That'll happen at follow-up assessment. Intake, we're really just getting at the very initial information for someone. If you imagine they're in crisis, they're seeking shelter, they're seeking a initial response to something, and then we're going to follow up with an assessment. And it's through the experience of that assessment, building relationship and ongoing case management and support with individuals that we're really able to fill out that picture and understand what the full host of barriers are. Does somebody have a chronic substance use history, serious mental illness, brain injury, intellectual disability, the physical disabilities? Oftentimes people are not candid and very open wanting to share that information, or criminal history. It's not hard to imagine that somebody doesn't want to reveal that information. They may perceive that they may be treated differently or have less access to something, and that's the last thing that we want someone to be concerned about. So it does take time to build that relationship with someone so that they're more comfortable and in a place where they can trust to divulge that information. And for some people, especially folks that do have a serious mental illness, they're completely unwilling to divulge that information. And so we really do have to work on our own to do that fact-finding, to build that case and ask questions in many different ways to try to really get at someone who says that they don't have a mental illness, but finally we are able to kind of glean out from the person they've had psychiatric inpatient stays, they're on several different psychotropic medications, and they're hearing voices, they're responding to somebody who's not physically there. Those are not things that people frequently want to or are willingly communicate. Does that answer your question?
Yes, and just to follow up, I'm sorry.
No, that's why we're here.
Within the 30 to 40 period for which they are eligible to stay in the shelter house, is that period too arbitrary or good enough to establish relationships that will help you get very useful data and services to these people?
It is. We don't limit the stays to that 30 to 40-day period because we would just be recycling and sending people out to the street only to be coming back in. There are organizations who say at day 45 you're out. That doesn't work. Those folks get to refer people on to us, and they do. So we are seeing the length of stay significantly increase, whereas back prior to the pandemic, in 2018, I think it It was. We were closer to like a 35 to 40-day average stay, and we really were seeing flow. Things were working as they should be, as we felt they should be. Shelter beds were turning over. We were getting people through the shelter and into housing, and opening up that shelter bed for that next person in line. Since the pandemic, we've seen that practically triple. Shelter stays are closer to 90 days now, and it's not for a lack of effort on our part. It is the macro and systemic changes that are happening in our community and with the population. So yes, we are definitely able to pull that data, get that information, build the records, build the relationship. What we cannot do is effectuate systemic change in the rental market. We cannot change the practices of UIHC, which a couple weeks ago discharged a woman in her mid-60s in her nightgown, or the hospital gown with a walker to our parking lot. These are things that happen frequently. There are things that we do not have the ability to make change without having visibility, without having access to the data, the information to try to then influence and change these things that are having incredibly negative impacts on the people that we're serving, on our work, and on our community.
So it's interesting that you say that there's, the people that you serve are vulnerable and have complex issues. But I just want to reiterate what you just said, is that there's also other systems that are complex and that make your job sometimes, I guess not, do I want to say vulnerable, but, you know, if this happens at UIHC, and then, you know, what else what do people expect Shelter House to do? You know,
Yeah,
these guys, you've been around for a long time, Chrissy, and so is Carrie and Aaron and all you guys. And, you know, the services that you provide are incredible. And it's just, the language that you use is so respectful. And, well, you know how much I appreciate you guys, but thank you for being here. But it's more than just the homeless individuals that are experiencing issues. It's the system that they're in that sometimes causes them not to be able to access housing.
Thank you, Marianne. That's very true. And I feel like the work that we've done over these last, especially 10, 15 years, has been proof of concept. We've demonstrated that the shift to housing first was the right thing to do. It had a very positive impact. It continues to. Developing permanent supportive housing in every way, shape, and form has had the impacts that we said that it would. Rapid rehousing, same thing. But we're not working within a static environment. The economy, the world keeps changing, and the goalpost keeps moving. Just recently, a report was issued. What's the entity? Treatment Advocacy Center, a national kind of watchdog entity for mental health services, ranking Iowa 51st in the nation, with only 2 beds per 100,000 people. 2 mental health beds per every 100,000 citizens, well, residents, excuse me. That has an immediate impact on our work. And because of those changes, those shifts and changes, just that one, it immediately has an impact on the nature of chronic homelessness and people with serious mental illness when you retract and pull away those resources that were once there. When our health system is on fire, our work changes significantly and becomes that much more difficult. And this is not hyperbole. This is every day for us.
You mentioned earlier, you know, the HUD funding that you receive and the other federal funding. Have you experienced, or do you anticipate changes in what you may be able to receive from the federal government?
We anticipate changes. We just don't know the breadth of the changes. We do know that given the current proposed budget of the administration, it will essentially eviscerate all of our permanent supportive housing and significantly reduce the resources that help to make us more than just a bed, a roof and a bed. We don't have any dates, we don't have any details or any plans. There's just intent that we've seen.
So you just do what you can and don't,
I think more than that, Carol, we're not only doing what we can, but we've invested in these two processes, these community processes for our stakeholders, to create some spaces later this year for the community to be able to say what they value and what they want to invest in, to be able to either retain current effort or change and improve effort. It really is going to have to be community-driven. This isn't something that Shelter House can fundraise out of. Our current gap for emergency shelter alone this year is over $700,000. That means that we're needing to fundraise at least $700,000 just to cover what most people consider a public service and a crisis response. That's book sales, barbecues, events that I've seen you guys at and really appreciate, letters, appeals. We can't do that, and that's just one program of the organization overall. We really need to look at, how does the broader community value this service?
Is there a specific action that we can take as a committee to put better resources into your hands? Let's say if we want a more efficient street outreach program engagement or transitioning between supportive housing for somebody who's chronically homeless. Is there anything that we can specifically do as a committee to put you guys in a better position to do your job?
I think, George, when we have the recommendations from the work with the needs assessment with Corporation for Supportive Housing, we'd love to share that with you and have a more data-informed recommendation for how you could support our work. Mm-hmm. I could right now say yes, invest more funding, but I'd like to be more strategic with you if that's okay.
Okay, of course.
Yeah. At minimum, I will say the recommendations that are going to council for aid to agencies, I just ask that they not be cut. I think that funding recommendation from the city staff is relatively level funding, maybe a slight increase. We desperately need that funding. It goes to emergency shelter operations.
I got a handful. Go ahead, Ames.
Thank you. We really thank you and appreciate the work you do. And Sam, I know your work is very, very difficult. I'm somebody who likes going to the library, all these kinds of places, and I see the folks you are trying to reach. And how does your team look like? Can you let the commission know the personnel, the mix of the people you work with, how it looks like? Because you meet all kinds of people out there. Yes.
Yeah, so we actually only have one street outreach and engagement specialist. Currently, his name is Darren. And that, like you said, does create challenges, right? I mean, you're trying to engage with, like Aaron mentioned, a population that is ranging from 18 to in their 80s and from a whole host of different cultures and backgrounds. And I would just say that's something that is a big hurdle for whoever's in that role. We have at our shelter, we also, on the emergency services team, there's a behavioral health coordinator that was piloted through the winter shelter 2 years ago, I believe, as someone whose role it is to build that relationship, build trust with folks when they're coming into shelter, to sort of ease that experience of entering a new complicated system, a sometimes chaotic environment. We have two service coordinators, so our two lead coordinators at the front desk of the emergency shelter, Maya and Kelly, who are both fantastic. And yeah, I mean, that's generally the group of folks who are on the emergency services team. And kind of will engage with just about everyone who is experiencing homelessness in our community, whether it's on the street or when they're coming into our shelter to seek shelter or just use our drop-in services throughout the day.
George, did you have something else as well?
I did not.
Okay. A couple quick questions. We talked about earlier, and this might be for you, Sam, so you might hang out up there. You talked about we're talking about the street outreach program 2024, the 90 transition from street outreach directly to permanent housing. Anecdotally, or your best guess, how many of those are recidivist? How many of those last for a portion of time in stable housing and then end up back? Because we know even with the emergency homeless voucher, we know we have people that do go into housing. I mean, I've got my own stories, where they are 2 or 3 or 4 months. Either they can't get the help they need or they hit a hard line of how much they can get as far as assistance. Do you have an estimate? I mean, even off the top of your head, are we seeing a 10%, a 5%, a 15%?
I wouldn't even know where to start on that. I'll say that it's a lot lower in permanent supportive housing.
Yeah, well, so I was just going to jump in here because, so I think where I had said previously, like individuals who are engaged in our street outreach services, where the best results for them to move into that supportive housing environment, because our permanent supported housing retention rates are really high. So we're in the 95% retaining housing, permanent housing, if they're enrolled in our permanent supported housing. And I want to make sure.
Is that what that 90 transition from street outreach would be? No.
So not all of them, no. I would say that some of them did move into permanent supported housing, because for Shelter House, right, you think of permanent supported housing, you think of Cross Park Place and 501, which are 60 units altogether, because they're in like a single site location. We have other permanent supported housing programs where we partner with the Housing Authority, where mainstream vouchers and emergency housing vouchers are being used to help people financially afford housing, and then we provide the ongoing case management services. So when we start to look at the total number of permanent supported housing, it's
and I'm just trying to get a general idea, because I mean the 167 that transition to positive housing,
Yeah.
It's so tough to figure out where they end up. I mean, a lot of it is just being self-reported that, oh, I'm going to stay with a friend. Or So of the 90 that we know move into housing, the question, I guess that's my question is.
We could look.
I mean, yeah, I just know if we. It's one of those ballpark, like how effective is that, or do we need to look at trying to get more people really into the permanent supportive housing side?
Do. Because I think for the most part, right, when you're seeing people recidivate to homelessness, it's because they didn't have the right housing intervention. So rapid rehousing or a short-term housing intervention allows somebody to have kind of that support for, let's say, 6 to 9 months, no more than 12 months, and a lease is typically 12 months, right? And so if somebody is returning to homelessness, number one, those case managers have a much larger caseload. We're talking between 30 and 40.
And I'm assuming this is some of that data, if the program with Corporation for Supportive Housing and Brilliant works, some of that data will be more available as far as seeing the long-term numbers and.
Well, what we would hope would come from that would be that there would be
Success failure rates.
a variety of housing options that would be available for individuals to move into that would be appropriate for what they need. And so, like I said, we could look now and see, based on those 90 individuals, kind of who we know have retained that housing. And then.
Or moved on from that into
Other permanent.
supportive or into permanent. Okay. It's a tough. It's hard coming from where I'm sitting, which is a very much a position of comfort. And when you see someone, you have 38 people in the middle of winter, and you say, "If I could get you a bed tonight, will you come in and sleep inside?" And they say no.
I think the shelter, I'll tell you, if you've never been to winter shelter, I would not want to sleep at winter shelter. It's not a great environment. It's a bed, but you're in a room with 40 to 50 other individuals. There's no privacy. If your neighbor is having a bad night for one reason
sure.
or another, you're not getting any sleep. And so I think that it's a life. I'm like, that's why we stress it's a life-saving service, because people are there because they could die outside, but they're not necessarily getting sleep, and or kind of.
So one of the things when I wrote that down, one of the things I wrote as my note down on the bottom is, it seems silly, is storage a concern for why some people don't want to go inside? I mean, obviously, we've worked with our share of homeless that have moved in, and hoarding is a real issue. Like, they've had nothing for so long that when they get stuff, they don't want to get rid of it. I mean, is there a program in place for, I mean, you guys, I don't even know, do you have like a storage program in place for transients or people on the bubble, or?
We don't have a storage. Storage gets really tricky when you
sure.
then become like the holder of somebody's items, especially somebody
Take responsibility
who,
for it.
as you mentioned, right, like has probably a disability, and part of that falls within like their need for items. And so we do not have a storage like service that we provide. There are partners that we have worked with when people have kind of like those vital item, or like, vital records and or items that are meaningful to them, that's manageable, but work with some of those partners to have them stored. I will say, yes, storage is probably one reason that somebody might give to say, I'm not going to come to shelter because I have all of my items stored right here next to me, and if I'm not sleeping here next to them tonight, they will disappear.
They'll be gone, yeah. Tent areas. Do they have 24/7 access, the people living outside, do they have 24/7 access to the 429 address, to bathroom? Like, do they take meals? I know you guys have some meal service type stuff. What do they have access to 24/7?
Yeah, so.
I know security's got to be an issue as well, because I know at night, usually you guys lock up, like, yeah.
Yeah, so I think that's a really good question.
Luckily,
so
Quick Star is around the corner.
In terms of food, we have, Shelter House does not provide food services to the individuals who are sleeping on our property outside of the building. There are other resources, so we make sure that they're very well aware of those. Free lunch, Salvation Army has an evening meal, and then as we have potentially other donated items, if somebody comes to our door and asks for something, we would provide it to them, but we're not providing them meals as part of our regular meal service. In terms of access to the building, they are able to come in and out of the building to use the facilities. You're right, in the evening time, so our doors essentially lock, or we want people in by 9 p.m. And so we get rather busy, as you could imagine, with 70 people in the building. And so it does limit their access. If somebody comes to the door and says we need to use the facility, they would be able to enter. I can also share that we, just this week, we were approved, and the city of Iowa City is providing some funding, 50% of the funds, to be able to provide a porta potty on site. So that way, if somebody maybe doesn't come into the building to use the bathroom, that there are other facilities on site. We also have what Sam briefly mentioned, which is drop-in services. Those are in the afternoon every day of the week, Monday through Friday, and then mornings on Saturday and Sunday, where people could come in and take a shower and use other, have access to other like hygiene products. They have access to that at any time, but they could ask for those in the same time that they're using the facilities.
So this is going to, I guess, point my direction to you, which is, and we talked about, Mary Ann's reading a book, was it?
Encampment.
Encampment that revolves around a church establishing outside living.
In Canada.
In Canada. So I guess my question is, obviously, it's happening. If other providers in town, what is the current status of Iowa City's regulations, yay or nay? I mean, is there anything in the books as far as like what is allowable, what's not allowable?
Are we talking about facilities specifically?
Well, I mean, more about permanent, non-permanent
Okay.
camping. I mean, as it were, on private or public property. Is there anything currently on the books, or is it just kind of a gray area? It's never come up, so we've never really had to.
I don't think I can answer that, honestly.
Okay.
There are some rules and regulations, but that's not what I was prepared to talk about.
Okay.
We can check into that and get back to you.
Yeah.
I was just going to, Aaron's probably going to have more details as far as our experience, but I will say that the Iowa legislature this past late winter, early spring, both in the House and the Senate, had language, bills proposed that would have criminalized homelessness, created sanctioned encampment areas, or required municipalities to create sanctioned camping areas where people would have to have an ID to
And register, yeah,
register to get in. They would need to be.
Both of those didn't get out of committee, did they?
They did not.
Yeah,
And
yeah.
it would also have criminalized
Yeah.
the homeless service provider.
Yeah.
So I just want to put that out there, that sometimes good intentions can very quickly lead to unintended consequences.
Okay.
This will come back in the next session. I
Oh,
just,
sure. No, I'm just curious. The reasons I was wanting to ask is I know we have a problem with private property, owners having to take, I mean, Staples and the Brugger's having to take people for FEDs, eviction to personal protection. My curiosity was going to be, as part of the outreach program, if you're going out and having outreach with people who are on private property, what's part of that conversation to say, like, let's get you someplace where you're not going to get served by the sheriff, you're not going to have that's what I'm trying to reach to is where do we know is safe in Iowa City currently for people to establish that non-shelter living?
I'm just going to say, I think the answer to that generally is nowhere.
Okay.
Like, everywhere has the potential, if you're sleeping outside, for that to become a place where somebody doesn't want you to sleep there, and they raise enough, there's enough concern or about that location where then they're asked to leave. And as you mentioned, right, maybe go as far as filing an FED to have them be off the property. So I can't confidently say that there is anywhere in this community that somebody could be sleeping outside that would not result in that, which is obviously a challenge when you are, one, experiencing homelessness, and then also just from a community perspective in terms of like managing. And so, Sam primarily, but Sam and I attend a monthly meeting where the lead department, many different departments from the city of Iowa City meet to discuss individuals who are sleeping outside. And oftentimes the individuals who are in the locations more specifically where somebody is sleeping come up because there's been a complaint. And then we're having to figure out kind of amongst the people within that meeting how we're going to approach this conversation, either within the individual outside. Best case scenario is asking for them to maybe stop something that is a concern to the person who is complaining about it, but allowing that person to maybe stay there still. Worst case scenario is they need to be off the property, and then that kind of gets into a enforcement side of things, which I'll tell you from a street outreach standpoint and from Shelter House's perspective, we don't take an enforcement perspective
Right,
or role, we are support. So if something formally comes about, then we are there for the individual and the advocate for that individual.
Who would, sorry,
Do
go
you
ahead,
think,
Marianne.
though, generally that if there is an unhoused person who's in a tent and somebody complains about that, do you think the unhoused person is going to like put up resistance to moving? Or don't you think that?
Yeah, typically, well, so typically the person making the complaint never actually talks to the person experiencing
Correct.
homelessness. So it never actually
know
gets
who it is,
to
right.
them until there's maybe a notice posted saying, hey, in 7 days, you need to be off of this location. And if you're not, then you could have an eviction filed against you. And that's where then street outreach is stepping in, because we don't want additional barriers to be
Right.
in place. And so an eviction would be an additional barrier for an individual.
That was going to be my next question was it Darren?
Yeah.
I mean, would Darren be the contact for private property owners to contact in advance of reaching out or
I think it
filing,
I think it depends on what the goal of the property, like the property owner is. So if it's to say, there's somebody experiencing homelessness living on my property, and I want to make sure that they're connected with Shelter House, because I want to make sure that they have resources and that, maybe they have a housing goal and we can help them move in. 100% yes. Darren with Shelter House is the correct person to contact. He can kind of start to introduce himself, number one, make sure that individual has what they need for the night, and then work on additional goals. If the property owner is like, I want this person off my property as soon as possible, then it's probably not Darren. Darren will come out and meet with them and say, receive the information, because we want to connect with that individual if we don't know who they are, but we're not going to give guidance on how to get that person off the property.
Well, and I guess I'm thinking not as how to get, I'm not talking about somebody calling you to say, how do I get them out of my property, but someone calling you to say,
Yeah.
can you come talk to this individual about vacating?
Yeah.
So that private property owners don't have to take the next step. I mean, from experience, I mean, I have gotten the calls, and I'm the first person. I'll go out and talk to them, and
Yeah.
9 times out of 10, they leave the laundry room, they leave the storage closet, they leave, out back behind the dumpster. But there is that 1 out of 10 times where you try to go to talk to somebody and. Well, they're either only there at night, so you don't have a property owner who's able to actually connect. So I guess my question is, aside from just calling the city or calling HSPS Legal Service and having a random 7-day notice to parties in possession written up,
Yeah.
is that something that the outreach team is willing to do as far as to try to connect with those people and say, hey, let's find you someplace that that you can be that's not in a shelter. Maybe it is out in the building, or maybe it's out, over by the river or something,
Yeah.
without having the private property owner to go that route. That's my question. And if the answer is no, we just don't want to mess with it, I
No,
get that too.
Our
but-
primary role is not to have somebody to intervene to have them move locations. That's not our primary role. I think that if there's safety concerns for the individual in that space in general, then we'll talk to the individual about kind of what those might be and talk about what where there might be a more safe location. But our primary role is not to come to ask them to leave. It's really hard to build a relationship with somebody, to get them to trust us to share information if we're coming with a kind of objective of our own. I'll tell you, when we, as a street outreach worker who's coming to interact with somebody, you're about as neutral as a party as possible to really just kind of introduce yourself and kind of learn as much as you can about this person, to be able to be there as a support to them. So in those instances, yes, I would say that Shelter House will get pulled in no matter what, because at some point in time, we'll have to kind of move towards a plan to help them move, if that's the goal, but not from kind of the first call.
Can I just ask a point of clarification? I heard you use this term as well, FED. What does that mean?
It's an eviction.
It's an eviction. Forcible entry and detainer is the official, that's what you actually have to file with the court.
Okay,
There's no such
that's-
thing as an eviction filing. It's
Okay.
it's
The
an
initials
FED,
is what
sorry,
I was
yeah.
having. I was
Forcible
trying
entry
to
and
find
detainer.
all kinds of things that could stand for, so, okay, thank you.
Yeah, those are hard to connect, FED and eviction. Yeah, I don't think you would ever get there if you didn't know.
Yeah.
Stan, anything else, anybody have anything else? I know that
Yes.
we had some people that had some hard outs, so.
Okay, just one.
Go ahead.
On the facility, the structure, the design, how, I know you have very knowledgeable about shelter, you read a lot. I see the book you are having us to look at today. It's a very good book. Actually, I checked one out from the public library. I have it.
Great.
And I know you interact with a lot of other organizations on how much has the design of the shelter houses changed? Because the people coming there are very different. Some are students who have just lost a house. Some are people who've just lost a job. Some are people who are chronic in the sense that you talked. So your clients are very diverse. But when they go there, you put them in one pool.
Yeah.
Suppose we had funds or the city or something happened where we have to renovate or build a shelter house. How different would you want it to look like to accommodate some of those barriers that make people say, I'm not going there for 1 or 2 days
Yeah.
or 3 days?
Well, so my first answer to you is that if the city has funds that they would want to use towards housing individuals, then I would say affordable housing units is what should be built and not a shelter. And then my second answer to that is that Shelter House actually did recently, over this last summer, renovate to make some of those changes to kind of update. Shelter at 429 Southgate was built and opened in 2010. So it's been quite a number of years since that building has been built, and there were some changes that we needed to be made, and most of those were safety related, safety not only for the individuals who we are serving, but also safety for our staff. So an example, if you've been in Shelter House in the emergency shelter before, where you would walk up the stairs and there was railings kind of like at hip height, you would now see that they are taller than an individual because we've had individuals attempt suicide over the edge of the railing, and we needed to raise that glass to a higher height.
Clarify between winter shelter and 429, because he's thinking.
Anybody have anything else? Can we,
And just
Dan?
to clarify, I
sorry.
mean, also, so emergency shelter, right, versus 420, versus winter shelter. And so I just want to make sure you're asking about our emergency shelter.
Yes, the emergency one.
Yeah.
That's the one.
Okay.
Yeah, we don't want to substitute good housing with another small little room that looks like another house. No, that's not the intention. But you want a situation where you balance things, that you do not make it look like, okay, this is the best you can get. And when I come there or somebody comes, they say, no, this is worse than being outside. Yeah, but that was my question.
Go ahead.
So originally, the place that was described as being worse than outside by some of the folks that were staying outside in the winter, that's the winter shelter. It is an open building with one like barracks area with no privacy. That's at 340 Southgate. That's a building that's owned by the county. 429 Southgate is our emergency shelter, year-round shelter owned by Shelter House. It's a 2-story building. There's dormitory for individuals who identify as male, a dormitory for individuals who identify as female. There are separate private family bedrooms. I think we have 8. They have their own bathrooms. The dormitory areas for the male and female single adults also have private rooms. In the men's dorm, there's a 6-man room and an 8-man room. There's two-person rooms for more private settings for people like if you've had a stroke or something and you need to be away from the larger population. So If you haven't had a tour of the shelter, I would encourage you to arrange for one. We're happy to welcome people in. But 429 Southgate Shelter is a very different environment than the winter shelter, which is just that open barracks space.
Yeah.
Wanted to clarify that.
Stan, do you have any, I feel bad that you kind of got stuck here without any real questions your way, but anything you want to add before we're done for the night?
Lumberman Senior Housing Inspector, so I oversee code enforcement as well. So I see the complaints come in. I sit on the committee that they were talking about, the Unhoused Committee, where we have different city entities that meet on a regular basis with Shelter House. We work very closely with Shelter House. I think a lot of times we're looking at harm reduction. You know, anytime you have somebody sleeping outside, it's not ideal. So then you get into the point, where is maybe a better space? I think Shelter House has done a really good job in the last year of kind of conveying that message that under the bridges, near utilities that Public Works people have to get access to or have concerns about probably isn't the best place. So you might see people in more visible locations. Again, it's not comfortable for any of us, honestly. We don't want to see people sleeping outside. When we get code, complaints in, yes, they may be out of compliance, but so is a banner in front of Hy-Vee is out of compliance. You have to look at it and what's the harm, and we feel very comfortable with the Shelter House's street outreach, that they're making the contact with people, that they're conveying the message, that they're moving people into safer locations. So I feel the city has a good working relationship with Shelter House, and we appreciate the work that they do for our community.
Cool. Thanks, Dan. All righty. Thanks, everyone, for coming and sharing and talking and yeah, kind of illuminating. We'll close that. Next, staff and commission updates. Anything staff commission updates? The only two is we did have the city approved, why am I drawing a blank on his name? Dowda's removal. He has 30 days to appeal. You haven't heard from him, I'm assuming.
I have not.
The other is that our request to move from 9 to 7 has been approved, sent to the Rules Committee, voted on, be voted on later this month or next month?
We think June.
I think June. So hopefully by this time next month, we will be down to 7. We will maybe hopefully have a new person appointed after the 30-day for Dowda is done. So that would be great. And we can not stress as much about being able to have ongoing meetings. Do you want to talk about upcoming stuff real quick for the summer? We've got June and July are going to be a little heavy.
Yep, I have just a couple of things here. So we've been waiting, typically we get our funding allocations from HUD in February. We finally last week received our CDBG and home allocations. For CDBG, we got a slight increase. For home, it was a slight decrease. The net increase overall was about $20,000, so we're very relieved and happy to see that. And that will kick off kind of a series of events that will come to the commission. So we'll be bringing you next month our annual action plan that programs our funding for the year. So it says what projects and activities we're going to undertake. So I'll be sending that to you for review here shortly, and that will be on the June agenda. That will also start a competitive funding round, so you'll have a grant application open this summer, and you'll be looking at funding recommendations to City Council for rental acquisitions and public facility projects. At the next meeting, we can kind of go over the scoring and what that process will look like, so you'll see that on the agenda as well. And then Kyle, you alluded to this. I just wanted to say that Mary Ann and Horacio, you both have terms ending in June, so if you're going to reapply, it would be a good time to do that. No pressure.
Okay.
I did.
You did? Okay.
Will I need to reapply?
You're good. They appointed you, I haven't seen them do this before, but they appointed you to that partial term and then a whole 3-year term, so.
They locked you in. You're not getting out
Yes.
now, so. Anything else from staff or committee or commissioners? If not, I would absolutely entertain a motion to adjourn.
So moved.
Second the motion.
All in favor?
Aye.
All opposed?
Thank you all for showing up in the rain. Appreciate it.